Okay, so I'm going to be demonstrating some behavioral techniques used for remediation of specifically ataxic dysarthria. The 5 techniques that I'm going to demonstrate all come from this book by Donald Freed, the first edition, Motor Speech Disorders, Diagnosis and Treatment. Okay, so I chose ataxic dysarthria because it's the most recent chapter that we went over, so I felt the most comfortable with those. The first 3 techniques that I'm going to show are specifically used to help with respiration. I chose these because ataxic clients often need to work on controlling their airflow during their speech. They have a characteristic uncoordinated respiration, prosody, and phonation. So the following 3 are going to be addressing those and are said to be helpful in gaining breath control. So the first one we're going to demonstrate is just slow and controlled exhalation. So what you're going to instruct your client to do is to, all right, I want you to inhale fully and slowly and steadily exhale. Beautiful. Okay, so what this is working on is increasing the length and steadiness of their exhalation and their breath control. There's variations of this particular technique that would be basically instructing the client the following. So I want you to do the same thing. I want you to inhale fully, and on your exhale, hold your breath up to 3 times, and don't inhale anymore, just beautiful. Okay, this behavior technique is useful. It's taught easily and can be practiced at home, which allows the client to improve awareness and control of their breath, especially their inhalation and their exhalation, which is necessary for the next behavior technique, which is going to be speaking immediately on exhalation. So one suggested approach to this is from N.B. Swergert, which is it's in the book. It's just referenced by Swergert. So I want you to place your hand on your stomach, and as your stomach begins to move in, or as you begin to exhale, as immediately as that happens, I want you to make the sound Beautiful. Okay. So once the patient can successfully utilize this behavioral technique, there will be minimized wasted exhalation for speech. This particular technique is useful because it's characteristic of ataxic dysarthria clients to wait a second or 2 after their exhalation to begin speech, which results in wasted breath. Okay, so the next technique, the third one, is stopping phonation early. The suggested approach is to teach this technique is to visually or verbally cue the patient at the appropriate time to stop phonation. The clinician can gradually fade the cues and prompts until the client is able to do it independently. Okay, so my sister Brianna here has normal speech. In ataxic dysarthria, they tend to continue on. So what we're going to do is model when would be an appropriate time for her to stop her phonation and take an inhalation and begin to speak again.
My name is Brianna Pritchard, and I go to Savannah Arts Academy, and I like movies.
Okay, so these are natural and appropriate places for her to stop her phonation. So I would cue her. If she were to continue her speech, those would be appropriate places to cue her to stop and to remind her to inhale. Okay, so this is useful because ataxic dysarthria patients often continue speaking, like I said, after their subglottic air pressure supply allows for them, which results in a quick rate, a harsh quality, and a decreased volume. Okay, the next behavior technique that I chose to demonstrate is a finger hand tapping that is used in improving prosody in ataxic dysarthria. This is first modeled by the clinician, and then, like the last one, the models can be faded out until the patient can do it independently. Okay, so what you're going to do is tap a metronome for her to speak on.
My name is Bree. I like sweet tea.
Okay, so you can You can make this as natural as you can. You can change it depending on the functionality of the client. Okay, and the final technique I chose for ataxic dysarthria addresses the articulation and is known as over-articulation or exaggeration of consonants. Okay, so I want you to make sure you exaggerate the sounds in the middle and at the end of your words. Okay.
I really think.
All right, Dr. Cox. We're going to try something a little bit more salient. I want you to use the same technique, but I want you to use it in the word community.
Community.
Okay. So this technique is a really great strategy for increasing intelligibility. The medial and final sounds are those that are most likely to be lost in connected speech. So by exaggerating these, the loss of those sounds can be minimized. A great side note is that this strategy and the one before this, the tapping, can also be really helpful in a lot of other disorders such as aphasia and other dysarthrias. And then the intelligibility, the last one, the articulation, with the medial and final, can also be really helpful with really any articulation disorder. So those are really great, but they're also specifically to ataxic dysarthria. So that concludes our video on the 5 behavior techniques that I chose, all addressing ataxic dysarthria, as I said. So that's all.